Good morning, everyone. This is Tammy Costrini from Insurance Advisors Direct. And today we have Letty Perez here with us from Pivot Health. And she is going to walk through their programs with us and tell us a little bit more about short-term medical plans and how that can benefit clients. There definitely is some niche opportunities there. And so just a little housekeeping. This is being recorded. We'll have it out on our website as well as our YouTube page. And if you have any questions during the presentation, please be sure to put them in the chat and we will get to them before the end of the webinar. Everyone's going to be on mute, so putting your questions in that chat will be the most important part. All right, no further ado, I'm going to go ahead and turn this over to Letty. Thanks, Letty, for joining us today. And you can go ahead and share your screen and your presentation whenever you're ready.
Great. Thank you so much.
Thank you.
Can you see that screen clearly?
Yes, we can see it.
Perfect. Perfect. Well, again, thank you so much, Tammy, for having me today, and welcome everyone. My name is Letty Perez, and I am the broker account executive here at Pivot Health. I'm going to be your go-to person for anything related to Pivot Health, the site, the products, and if you need any assistance or guidance. At the end of the presentation, I will have a slide sharing my contact information, so I want to make sure you don't hesitate to reach out for assistance. Want to give you a little bit of background for those of you who are new and not familiar with Pivot Health and as to who we are. So Pivot Health is not an insurance carrier. We are actually a product development, marketing, and management company. So we design products and then we bring them to market, but we actually have carriers that insure the plans. And Pivot was founded back in 2015 by executives that have many, many years of experience in this specific market. And I've had the pleasure of working with them over my career. I was just talking to Tammy and letting her know that I'm going on 24 years specifically in the short-term and individual market. In 2018, we were acquired by healthcare.com. And the reason I share that with you is because you'll see that my email domain is healthcare.com. So a couple of different names, don't want you to get confused. And healthcare.com is actually an insure lead tech company. So just sharing that info so you understand how we're related to healthcare.com, and also the fact that since we are not a carrier, you want to make sure that your clients, when you do sell a Pivot plan, that they are not going into a provider and telling them that they have Pivot Health insurance, because we are not a carrier. Their ID card will clearly state which company is actually insuring their plan. I'm going to start out with this for those of you who are somewhat familiar with the short-term industry. So back last summer, late summer, the current administration put out a notification that they were planning on making some changes to short-term medical durations. So we expected this ruling to happen or be decided on towards the end or the beginning of Q4 of 2023 to implement that change for 1/1 effective dates. Essentially, what they're doing is the government is looking to shorten the durations allowed for our short-term medical plans, for all short-term medical plans across the country where the plans are sold, limiting it down to a 3-month coverage period. They mentioned potentially allowing an additional 30 days, which would be a total of 4 months of coverage. And that rule was supposed to be per carrier. Well, we started gearing up and getting ready for those changes. I personally have lived through this before. This happened years ago, and then it was undone, and they reopened it up and allowed the states to decide on what the durations they wanted to offer. Nothing happened through the end of the year. Last update we got from our lobbyist in Washington was at the very end of 2023, and we were told that a final ruling had not been decided on yet. We probably will not hear anything else until the end of Q1 or early Q2. And if they implement the change, it would not take effect until mid-year. So great news for us, right? Q1, business as usual. Agents are selling extended durations, which I'll go over as much as possible, because the existing policies or policies in force, even if the administration goes through with the change, are to be grandfathered in, is what was presented. So just a little bit of background on that. And of course, once you're contracted with Pivot, you will get notifications, you'll get emails. Always check those emails that come in from Pivot Health, because we will give any updates should any changes be upcoming. I personally don't see the advantage of the administration making this change mid-year. It made sense for making changes for January 1, because it would have would have had a bigger impact on open enrollment for ACA plans. They're looking for everyone to use an ACA plan versus other outside options. Doing it mid-year is really not going to improve their enrollments, because coming off of a short-term medical plan does not qualify as a special life event to enroll in an ACA plan outside of open enrollment. So just a little bit of legal background on that. And again, we will keep you posted should any changes, and of course our website would be updated accordingly. And the site will always guide you and only allow you to sell what is legally available in the state that you're quoting in. For those of you who are new to short-term medical and have not sold it in the past, wanted to just go over a couple of different tips on what's the difference between short-term medical ACA. Well, let's keep in mind that ACA plans are guaranteed issue. Everyone is eligible for an ACA plan, right? The only thing that they will use would be a subsidy calculation to see if they're going to get any assistance on the premium that they're going to get charged for that ACA plan. STM plans are not guaranteed issue, but they're not financially driven. We do have a simplified underwriting application that will determine whether the person is eligible for coverage. So these plans do have limitations. They do have exclusions. They don't cover everything. But hence, that is why the premiums on short-term medical plans are going to be much more attractive for those healthier people that are not getting any type of a subsidy or a large enough subsidy to make a difference in their premium. Our plans have flexibility. We've got open access plans. That means that the client does not have to stay within a certain network in order to utilize their short-term medical coverage. Also, the plans that we offer with a network tied to them are still good to be used anywhere throughout the United States, so long as it's issued in a state where the plan is available. As we know, ACA plans are very much more restrictive. Really, the benefits are designed to work primarily in the state where the policy was issued on an ACA plan. And again, I talked about that open enrollment and that special enrollment qualification in order to sign up for an ACA plan. With short-term medical plans, you are able to sign up a client today for a tomorrow effective date. So it is an open enrollment 24/7, 364 days a year. So you do not have to worry about them qualifying to be able to enroll in a short-term medical plan. And again, these plans are not for everyone. You want to make sure that the person is a healthy person. A couple of red flags. I've had agents call me and say, well, I've got a potential client. They gave me a list of doctors that they see on a regular basis. They take X number of prescriptions, monthly. That's probably not a good fit for a short-term medical plan. One, even if they are able to get through the application underwriting. That's someone that's probably got some other issues going on or complications that, this may not be a good fit for them. So just to give you an idea, as you are working with leads or potential clients, couple of different things I want you to keep in mind as to who might be a good fit for a short-term medical plan. So let's keep in mind, we have people, those part-time workers that are not going to get offered coverage through the employer. We've got those gig workers, which is a huge population today. People are not sticking to, one company, or they are contracting themselves out. And then, of course, if they're 1099, they're not getting offered benefits by the company. We have a large population of early retirees. We have people that are deciding they're not going to wait till they're 65 to retire. So if they do opt to do that and they're not yet Medicare eligible, that's 60 to 64 and 11 months of age on an individual plan, or an ACA plan, I should say, is going to be very, very expensive. We are very competitive for those healthy people in that 60 to 64 and 11 months of age band. So this would be a great option for them. Those that have lost their employment or have quit a job and are waiting to get enrolled or find a new employer, or if they have started a new job and they have that waiting period before their benefits will kick in, this is a great option for them. Those that are self-employed that don't have access to a group insurance coverage, and college students, or those that are graduating and do not have a job yet that is offering any type of coverage. Great opportunity. And these plans will cover a dependent, just like an ACA plan, through the age of 26. But then they would age off, and then they can get their own short-term medical plan. And again, those families that the ACA is just unaffordable for them, if they're not qualifying for a large enough subsidy. So just a couple of different things for you to keep in mind. So when you want to think that offer a short-term medical as a good option for a client. So when you are contracted with Pivot Health, you're going to get a welcome email with your writing number. You're going to get logged into your Pivot Agent portal. So these are going to be the proprietary that we offer. You're going to have a short-term medical, which is our niche product. You're going to see a lot of different options. I'm going to go over the different plan designs and some of the key features of those plans. And then we have a dental and vision tab where you can offer dental and vision as a standalone product, or as an add-on when you're selling a short-term medical plan. And there's going to be 3 options. Great option if you're working in that Medicare market. Our dental and vision can be sold at any age over 65. There is no maximum age for that dental and vision. So great opportunity to add on that coverage if they don't have dental. We have a supplemental product. It is an accident, critical illness, hospital indemnity, and accidental death and dismemberment product. And it's available as a check the box only when selling a short-term medical plan. But keep in mind, when that short-term medical plan expires or terminates, that supplemental plan will stay on the books so long as they continue to pay their premium until the client reaches the age of 65. So it's a good product. Let's say they came off of the short-term medical, went on a group coverage, or went on an ACA plan. That supplemental product can still continue to be used. So let's go over what makes the Pivot Health short-term medical products unique. And we know we are not the only company out there offering short-term medical plans. And you'll see that we've designed an array of different plan options that are bound to fit your client's needs and budgets. Those extended durations I mentioned when I was talking about the current administration potential changes. So an extended duration plan, we offer a 2 by 180 day, 3 by 364 day, and 2 by 364 day coverage periods. Now, this is going to vary by state, and by product. What essentially this means is that the person is signing up today for multiple coverage periods back to back without having to go through the application process again. So no additional underwriting. They don't have to worry about how being able to answer the application questions to be eligible. There's no new pre-X look back. Keep in mind, if they develop a condition while they're on that first coverage period, and that condition is, let's say, a heart attack, or they developed a cancer that would not allow them to re-enroll in a short-term medical plan if they had to go through the application process, we cannot deem that as a pre-existing or deny them that their second or third coverage period because they were on an extended duration. So that condition would continue to be covered. No new waiting periods on the subsequent policies, and all the benefits, including deductibles, copays, and benefit maximums, reset with each new coverage period. So our benefit maximums on the pivot plans are per coverage period. They are not lifetime. So if your client selected a plan with $1 million total coverage, let's say they developed a cancer and they used up $800,000 of that total coverage for their first duration. When their second policy starts, everything has reset, including deductibles and coinsurance, but they would get another $1 million total coverage for that next coverage period. And the commissions are going to remain level. So important for you, these are not treated like a second year or second tier coverage. So the commissions are going to remain level as though each new policy is a brand new policy. And the premiums are going to be locked on our companion life plans. So they're whatever rate you offer them when you're quoting them, that is going to be their that's going to be their premium for the subsequent policies as well. And that is going to vary by state, of course. We do have a North River product that is going to have a trend increase with each new coverage period. So it is going to be for the companion life plans only, which I will go over. We've included preventive and wellness benefits in all of our plans now. We have plans, as I mentioned earlier, that use national networks, but we are mostly known for our open access plans. These plans offer the client the freedom to go to any doctor or any facility. And with these plans, we're going to use what we call reference-based pricing to help reduce their out-of-pocket expenses. Again, our policies are a simplified underwriting. So there's going to be no MIBs run or any prescription history after the application is submitted. And, so you won't expect any type of a decline. Their eligibility is going to be based solely on how they can answer the application questions. They have to be able to answer no to all the questions in order to be eligible for the coverage. We don't have rate ups, so you're not going to see a tobacco use question, which will normally increase their premium. We accept controlled hypertension, controlled diabetes by diet and exercise only. We do not require a social security number. So if you're working with a client that is not a US citizen, they don't have to have any type of documentation. They only have to be able to answer that they have resided in the United States for the prior 4 months. With our open access plans, we've partnered with a patient advocacy service called Point Health. They can help the client on an open access plan look for a provider or a facility in their area for the specific services that they need. And they also offer bill negotiation services for those higher out-of-pocket bills that they're responsible for if they need assistance. And Pivot's known for designing products for certain niche markets. So we cover student athletes. So high school and college athletes are covered. Our child-only policies are as young as 6 months of age. So you can put a baby on a plan by themselves as young as 6 months old. If you're putting multiple children on a plan without an adult, the youngest cannot be under the age of 6 months. If you do have a baby under the age of 6 months, they are eligible for coverage, but they would need to be included with an adult on the plan. And our policies are available from as young as 6 months of age all the way up to 64 and 11 months of age. So right up to that Medicare eligibility. And still till today, our largest market segment is that pre-Medicare market, that's 60 to 64 and 11 months of age. Again, because the premiums are so competitive versus an ACA plan for that age band. And we do have included in all of our plans free and unlimited telemedicine. That includes dermatology consultations. So you want to make sure that your client understands if they select a plan that doesn't come with those office visit copays for those sick visits, they still have that access to that free and unlimited telemedicine, which will cost them nothing, not even a copay. And as I mentioned, we are not the carrier, so we have 2 carriers that insure our short-term medical plans, and both are A-rated carriers. So the different types of plans that we offer. We have our core plans, which we call our light short-term medical plans, and they are a passive PPO, which means the client has access to use a First Health Network provider, but the benefits would stay the same, whether they go in or out of network on those core plans. But because we call them the light plans because there are some limitations that I'm going to go over. Classic plans are going to be all open access plans with no network restrictions, a large array of plan options for those classic plans I'll go over as well. Our Epic plans are going to have 2 different plan designs. One is going to be an open access. One is going to be a PPO plan. And then our Quantum plans are true PPO plans. So the benefits will drastically reduce or they would lose benefits if they go out of network on those Quantum plans. And just so you know, the Quantum plans are not going to be available in states like Texas or Georgia. And I mentioned those 2 states because those are 2 of our top selling states. So the core plans. With the core plans, again, these are underwritten by Companion Life Insurance Company, and they are what we call a light short-term medical plan because they do have some limitations. Also, it is a passive PPO. Client can utilize a First Health Network provider, but they are not limited to the First Health Network provider. They can go out of network and benefits would remain the same. So these plans are very attractive, low deductibles, low coinsurance out of pocket, maximum coverage $750,000 per coverage period, prescription drug benefits. The Core 1000 is a discount card. The Core 2000 is going to have RX benefits with copays, no RX deductible. But do keep in mind, any of the plans that we offer with RX copays will have a maximum benefit for the RX based on the duration of the plan. So if you're selling a plan up to 6 months, that RX benefit maxes out at $1,000. If you're selling a plan up to 364 days, that benefit would max out at $2,000. These plans offer office visit copays. So it's a $30 copay for a primary doctor, $60 for an urgent care or a specialty doctor. Now, keep in mind, those copays are going to be limited to 3 visits per insured, per coverage period, and it is combined. So if they went to a primary doctor once because they weren't feeling well, and later on down the road, they went to an urgent care, they went twice, they would have used up those office visit copays. And keep in mind, those are not for wellness or routine visits. Those are for sick visits only. Now, more importantly, I want you to be sure that you understand the limitations on the hospitalization benefits for these core plans. And these are the only plans designed this way. All of our other plans are going to be deductible, coinsurance, and then the plan kicks in up to the maximum for covered services. So with the hospitalization benefits, for example, what you're seeing here on this is a screenshot of the brochure. These are the maximum dollar amounts that the plan covers, not the responsibility of the client. So if your client were confined to a hospital, the maximum benefit would be $1,000 per day. That includes room and board, nursing services, and any miscellaneous charges. If they're in an ICU unit, it would be limited to $1,250 per day. So for this reason, the majority of the people that we see on our core plans are going to be that younger age band, that under the age of 30, or child and children only policies, because these policies work great for those everyday type of expenses. Agents that sell these plans to the older age bands, because of the risk of a lot more out-of-pocket exposure should something happen and they need to use those hospitalization benefits, they will stack it with some type of an indemnity product that offers hospital indemnity benefits to help with that out-of-pocket exposure. A preventive examination. This would encompass a wellness visit with a primary doctor, like an annual physical or routine checkup. It's going to cover up to $200 towards that visit. Make sure that the client understands this does not include, that preventive benefit does not include routine child care visits that children go to on a regular basis. And it does not include a routine annual OBG exam for a woman. I have had agents say, well, my client uses her OBG as her primary doctor. Unfortunately, it would not qualify under that $200 benefit. An annual OBG visit would be subject to deductible and co-insurance. So just some key features of these plans that you want to make sure that the client understands what they're purchasing. The classic plans, these are all open access plans underwritten by Companion Life Insurance Company. So there's going to be no network restrictions. They can go to any doctor or any facility. These plans are going to offer benefits like deductibles ranging from $1,000 all the way up to $10,000. Maximum coverages from $100,000 all the way up to $1 million. When it comes to those office visit copays, as I described for those sick visits with the core plans, you're going to have a choice plan and a deluxe plan that offer those same office visit copays. These plans all offer that preventive or wellness visit that covers up to $200 for that routine annual visit with a primary doctor. If the client is looking for a plan that has prescription coverage with those copays, as I described with the Core 2000 plan, you would want to offer a standard or a deluxe plan. So these plans offer a lot of great benefits, and you'll see in your quoting portal that based on the plan that you select, the premium range is going to be quite expansive as well. So I'm sure you'll be able to find something that would work best for the client. And with these open access plans, keep in mind that they are going to use reference-based pricing to help reduce their out-of-pocket expenses. And I'll be going over that for those of you who are not familiar with reference-based pricing. The Epic plans are underwritten by North River Insurance Company. They are an affiliate of Crum & Forster. They are also a rated carrier. And I mentioned this earlier, there's going to be two plan designs under the Epic category. There's the Epic PPO plan that utilizes a Cigna network. Again, let me reiterate, it is not a Cigna insured plan. It is insured by North River. We just have the contract to utilize the Cigna network. And you see the middle column here shows you how the benefits would differ if in fact they were on that Epic PPO plan and went out of network. The Epic base plan is an open access plan, just like I described with the classic plans. No network restrictions, no affiliation to that Cigna network whatsoever. The Epic plans, both the PPO and the base, are 100% coinsurance, which means that Whatever deductible the client selects, that's going to be their max out of pocket. Once they satisfy that deductible, their max out of pocket would be satisfied, and then their plan would kick in up to the maximum coverage. These plans do not offer any office visit copays, so any of those sick visits would go towards the deductible. With the PPO plan, it would get the network rating. With the Epic Base, they would get reference-based pricing for those visits. These plans also offer that one preventive or wellness examination benefit, but with the Epic plans, there is a 3-month waiting period to utilize that benefit, and it is going to cover up to $100 towards that visit. A different feature with the Epic plans as well, you're going to see while enrolling a client with an Epic plan, with the exception of Pennsylvania, where our Epic plan is available, it is not going to offer this supplemental accident rider. In all other states, when enrolling the client, you're going to see they can select a $5,000 or a $10,000 benefit. That benefit is going to cover expenses incurred if the insured were injured in a covered accident and required medical attention within 72 hours of the accident. So great benefit to have. Now, keep in mind, it is a rider attached to the policy. So once the policy expires, that benefit is gone as well. It is not a standalone. Also, when you're quoting Epic plans, you're always going to see the plan offered twice. First option is not going to include RX coverage with copays. Second option will include the RX coverage with the copays, no deductibles. And again, the benefit's going to be based for that RX coverage on the duration of the plan. Some states you're going to see both Epic Base and Epic PPO list offered, and some states you'll only see one option. Again, the Epic PPO plan uses that Cigna network. The Epic Base is open access plan. So let's go over the reference-based pricing. I keep mentioning this on the open access plans. So which plans are going to fall into this category? So our classic plans, that was the standard, deluxe, economy, and choice. The Epic Base plan and the core plan, we still categorize that as an open access because remember, it is a passive PPO if they choose to use that First Health Network provider, but they are not they're not limited to the network. So essentially, the plan works as follows. Client submits provides their provider or their facility with their ID card. The ID card has all the information on it, just like any other insurance card, with the information on verifying the benefits as well as submitting claims. The claim should be submitted to us directly from the provider. This is not a reimbursement plan where the client has to pay up front and then files for a reimbursement. Claim gets filed. We are going to use Medicare allowable or usual and customary for covered services to determine the amount due to the provider or the facility. So for a provider, we're going to cover up to 125% of the Medicare allowable or usual and customary for that covered service. For a facility, we're going to pay up to 150%. So the client goes to the provider, claim gets submitted, bill comes into us, we're going to do the adjustments and provide the discount, and the EOB would show what the patient responsibility would be. On average, we see about a 69% savings from the retail charges with using this reference-based pricing. Now, this comes with balance bill protection, which means that should the provider send the client a balance bill due to the discount that we took, they have the right to send that in to us. We are going to settle out that bill on their behalf. So they are not going to be responsible for that balance bill. And then for these open access plans, we have that patient advocacy service I mentioned. They can help navigate and find providers and facilities that work best in their area for the services they need. And they also provide bill negotiation services. You're also going to notice when you're in your quoting portal that the premiums on the open access plans tend to be much more competitively priced because there's no provider access fee. So the plans that utilize a network, there is an additional charge that we get charged to have that contract, and that gets passed on to the client with their monthly premium. Then we have those plans, the Epic PPO that I already went over, and I'm going to go over the Quantum plans now that utilize that Cigna network. Again, they are not Cigna insured. We only have the contract to use the Cigna network. And then we have that First Health network available to the clients on those light short-term medical plans, the core plans, but they are not limited to that. They can go out of that network as well. Quantum plans, last category of plans. These are true PPO plans. These plans are underwritten by Companion Life Insurance Company. They are not underwritten by Cigna. We just have the network, the Cigna network that we can use on these plans. There's two plan designs. There's the PPO high deductible and the PPO copay plan. You see here on this screenshot of the brochure, the third column is showing how their benefits will reduce or they'll lose benefits if they do go out of network and they're on one of these Quantum plans. With the Quantum plans, the max out of pocket is always going to be $10,000. That is going to include their deductible. If they select to be on the Quantum PPO copay plan, they get those office visit copays as well as prescription coverage with the copays. Both plans offer that one wellness or preventive visit. It covers up to $250 towards that one annual visit, as I described earlier. These plans are very rich in benefits. They include a supplemental accident benefit. It is not a rider like the Epic plans. It is included in the plan where it will cover up to the plan deductible selected by the client for any expenses incurred due to a covered injury if the client required medical attention within 72 hours. So these plans are definitely very rich in benefits. Our ancillary products, I mentioned our Brilliant Dental. Brilliant Dental plans are underwritten by Renaissance. It is a PPO plan. You're going to have 3 plan options to select from. The ages for eligibility are going to be as young as 18 years of age, no maximum age. So you can sell it to a client that's 85 if you choose. Now, if you have a client that has children under the age of 18 and they need the benefits, the children will have benefits providing there's an adult on the plan with them. And that's whether or not you're selling it with the short term as a check the box or as a standalone product. The value plan is a basic coverage only. There's a 6-month waiting period for those services. With the essential and maximum plans, there's no waiting period for any of the services. The benefits are progressive, so they increase from year 1 to year 3 and then stay level. And if you are including children, I would highly recommend that you offer the maximum plan. That's the only plan that includes child ortho benefits. You'll also see that when you're offering the dental, you have an option to check the box and add on vision coverage through Vision Care, and there's going to be only one option. Vision is not available without the dental, so it is only available as an add-on when you're selling a dental plan. Latitude plan. This is our supplemental plan that I described briefly at the beginning of the presentation. This is offered through Communicating for America, which is an association, and it's the bundled product, accident, CI, hospital indemnity, and accidental death and dismemberment. It is going to be available as a check the box when selling a short-term medical plan. If you're doing a child-only short-term medical and Latitude is available in that state, you will not have the option to add on the Latitude plan because the minimum age is 18. Again, if you do have children and they're included with an adult, they would have access to the benefits on the Latitude plan. And the plan, once the short-term medical plan goes away, Latitude can be kept until the client turns 65. And keep in mind, these ancillary products are billed separately so that these plans can stay on the books after the short-term medical plan goes away. There are 2 plan designs with the Latitude. It's a select plan with a $2,500 benefit and preferred plan with a $5,000 benefit. These benefits are paid directly to the member so that they can use that money however they see fit. And these plans do not coordinate benefits with any other coverage. So it's going to pay regardless of whether or not the claim was covered by another plan. Because this is offered through an association, they are going to get some non-insurance benefits through the association as part of their membership. I wanted to mention that Pivot has also decided to add on some preferred partners. And I discussed this with Tammy. These are going to be a separate contract if you're interested in having other products available. Especially, it's kind of filling the gaps in some of the states where short-term medical plans are not available. So we've got some healthcare sharing plans. We've got some fixed benefit plans. There are MEC plans, hospital indemnity plans, gap and supplemental plans, and there's also going to be some additional dental and vision options if you'd like. So feel free to reach out to Tammy or myself and let us know if you're interested in getting contracted to have some other products available to offer. Once you get contracted, you're going to get a welcome email from Pivot's contracting area with your Pivot number. That you're going to use to register into your agent portal. You would click on the top here where it says for agents. And then the next page is going to show you to go ahead and get logged in. You are going to be considered an appointed agent because you've got a writing number. Once you register into your portal, this is what the landing page is going to look like. The product portfolio tab has a drop down. In there, you're going to find brochures and marketing information for all of the different plans that I've just gone over. Helpful Links is going to have some training materials and other good marketing materials in there for you as an agent. My book of business is going to have a listing of all your Pivot business. And as the agent of record, you have access to view those documents, ID cards. You can download them in PDF and share them with your client. That's going to be in your back office. And then, of course, get a quote. Down here below, under news and information, there's a state availability chart. So I'm just going to address the rulings with Michigan. So Michigan only allows a 6-month coverage period, and it is per carrier. So keep in mind, in Michigan, we have both our North River Epic plans available, as well as our companion life plans. So we have agents that are covering their clients for up to 12 months and keeping the business with Pivot, because you can go back and forth between the 2 carriers because it is a separate carrier. Keep in mind, Pivot is not the carrier. So we are staying within the rules of the law in Michigan by doing that. Of course, get a quote. Nice thing about our quoting portal, you're always going to start with the zip code. That will allow the site to only display plans and options with durations available in the zip code that you're quoting. So it will not allow you to run through an entire quote, try to sign someone up to come to find out that that plan is not available for them. So all the fields are going to be required on this first page with the exception of the email address. I recommend you leave that blank. Also, if you are offering, adding on a spouse or children, you want to do that on this page. Of course, it is going to affect the premium. When you open up the portal, if I was in my portal right now, the desired start date would be displaying 2/17/2024, because as I mentioned, you can start coverage as early as tomorrow. This little calendar here on the right-hand side lets you pick an effective date as far out as 60 days from today. But I want to make sure everyone's clear and understands whether your client's coverage is starting tomorrow or in 30 days, 42 days, 50 days from today. Their first 30 days of coverage is going to get drafted. Their premium is going to be drafted upon submitting the application. Once the policy is in force, they will get charged on their effective date each month. For those of you selling in Michigan, where 6 months is the longest duration, we do offer a prepay option for 6-month policies. And keep in mind that offers that client a 25% savings off of their premium. Now you say, well, my client's signing up for a policy, but may get coverage in 2 months down the road or 3 months down the road. These plans can be canceled after the first 30 days of coverage of the policy being in force, and we do prorate any unused premium. So even if they prepaid, they wouldn't lose all that money if they had to cancel, let's say it's 60 days into the 6-month policy. The site will always default to the longest duration available. Keep in mind, this is for one policy duration. This is not the extended duration options. You'll see that on the next page. And I used Florida as an example when I created these screenshots because it does have all the different plans available as well as the durations to offer. The next page is going to show you, once you click on Find Plans, 3 recommended plans. Keep in mind, these are not the only options. And as you see here in the top right-hand corner, their extended durations were already selected based on the demographics that I entered for this example. You have Show Filters. This will allow you to open up and start narrowing down your plan options if your client is looking for certain specific benefits. And what it does is it eliminates any plans that don't fit that criteria that you selected. Or you can simply continue to scroll down this page, and this is what you would see. You'd see a listing of all the plans available. I stopped at the choice plan. This is one of our classic open access plans. You see here, these boxes with the benefits, you can actually click on the down arrow and open up and adjust the benefits as you see fit. If your client is looking for a couple of different options, they want you to email them the quotes so that they can make a decision, you can make the adjustments to each plan, click on the Add to Compare, and collect up to 3 different plan options, and then you're able to email that over to the client. If I go to the next page and I click on View Details here, I've selected the Epic Base Plan. I wanted to show you what this looks like. I selected the option including the RX coverage with the copays, and it'll indicate it here. Showing you what the extended durations look like if I open up the duration box. And then I'm going to click on View Details to show you what the summary page would look like. So here I've clicked on a dental coverage and the latitude plan. I've now got the 2x364-day coverage included, and this is showing what the monthly cost would be, but that's including the dental and the vision and the latitude. They are going to be broken out, and I'll show you. If you clicked on the View Details, it'll take you to the next page. Here is when you would see the supplemental accident rider. Keep in mind, Epic Plan only has this rider, with the exception of the state of Pennsylvania, which is the rider is not available. So they can select this benefit. On the right-hand side, you're going to see a summary of what's been selected. If they need to change the dates on the coverage, they can do that by clicking on the edit button. As you see, everything is broken out, and I apologize. I've got an error here. I copied the latitude twice, but this does have a breakdown because keep in mind, it's going to be 3 separate charges each month if they go on a monthly bill. Here you can email this quote to the client. So this would give them the Epic. It would show them the Epic plus the dental and the latitude. In the email that they receive, you get copied on that email. So you'll see exactly what they're looking at. The site does not store any quotes that you created, but they can view the details, they can open up the brochures, and they can actually start the application process from that email. And you, of course, would be the agent of record because it came from your link. Just a reminder on the simplified underwriting, when you go through the application process, and I would recommend run through a dummy application, put your own information. Nothing is going to happen unless you put in a payment method. So we're not going to ask for a tobacco use question. We do not have a height and weight chart. We only ask, the limitations are on weight. So a female cannot be over 250 pounds. A male cannot be over 300 pounds. Again, we also do not ask for a social security number. So they only have to be able to respond that they have resided in the US for the prior 4 months. If you click yes on any application question, the system will stop immediately at that question and not let you proceed with the application. They have to be able to check a no to all questions in order to get to the completion of the application. Oh, I apologize. Very easy process. And I apologize. I believe I skipped a slide. Once you complete the application, the demographic information, a couple of key things. They can pay by ACH or credit card, whatever payment method they use when they submit the application. That's what they're going to continue to be charged each month going forward if they didn't select a 6-month prepay. If they choose to change their method of payment after the policy is enforced, they would need to call in to the client services area. And also, if they're on a monthly bill and they want to change their draft date each month, they can call in and do that as well. Once they complete the application, they submit it electronically. You get a confirmation email that your client has signed up for a plan. That policy will be in your book of business almost immediately. And the client gets a welcome email with instructions how to log into their member portal so that they can download their ID cards and view their policy documents. Keep in mind, nothing is mailed out. There are no physical cards mailed out or policy documents. If the client insists on getting something in the mail, just make sure they understand it is going to be a paper printed ID card as well as documents. There's not going to be a hard card. It is basically the PDF that they can download from their computer, as well as the same what we can do from our side, you as the agent and us administratively. Very easy application. They do get a 10-day free look. So if they decide to cancel within the first 10 days of the policy being enforced, they get a full refund, including their app fee. Just want to make sure you're all aware we are running a bonus program. So keep in mind that you can make some extra money besides your commissions. And we do try to run bonuses quarterly. So I try to keep you up to date on those. There is no registration process. We're going to track your business and determine when you're eligible. And if you need the flyer, I'll be happy to send it over. I'll make sure I get it to Tammy so she'll have it available as well. And I'm going to keep, this is my contact information. Should you have any questions or comments or you need assistance, feel free to contact me. And I'm going to turn it back over to Tammy to see if there are any questions or comments that are needed to be addressed.
Thank you, Letty. That was a great presentation. I think the only question that may be pending, and this is maybe more for your preferred partners,
Okay.
is if there's any plan that covers people over 65.
I believe, yes, there are. And all the plans through our preferred partners are guaranteed issue, by the way.
Wonderful. So I know there was a question about that. We do have agents who deal with immigrant populations quite a bit, and they have over 65 people.
Awesome.
So if you wouldn't mind sending me some information on those, then I can make sure that the
Sure.
agents that are interested get that. And you know, we can follow up on that at a later date. But
Perfect.
I
I'll
think
make
that
sure I
was
get
the
that.
only other, thank you. I think that was the only pending question that we had. If anyone else has any questions, please feel free to put it in the Q&A or the chat right now. And otherwise, this, like I said, this is being recorded and will be up in the next few days on our YouTube page and on our website. And then, of course, you can always reach out to me if you have any further questions. If you're interested in contracting for this, it's a great product to keep in your back pocket. It may be, a specific niche, particularly if you're in Michigan, but great information that would, since they have two carriers, we can piggyback those, so to speak,
Yep.
so that they can get a year's worth of coverage, particularly since we're just outside of OEP. I know that's been coming up quite a bit. So I do not see any other questions. So with that, I will give you all back a couple of minutes of your time. And thanks again, Lenny. This was a great presentation, and we look forward to a great relationship with Pivot Health and Companion.
Absolutely. Thank you. I appreciate that. Look forward to working with everyone.
Wonderful. Thanks again, everybody. Have a fantastic day.
Bye bye.